When it comes to cancer survivors, do you normally go for a silicone or a saline? How does that work in terms of what they choose?
Implant has evolved also completely, and every day we have new stuff coming out with implants. I believe, and I strongly believe, that the best implants today for reconstruction are the cohesive silicone implants. Mm-hmm. I can show you here, this is an implant that is saline,
okay.
So it's harder. You can feel sometimes the water on it.
Yeah.
And then you have the evolution.
Yeah, it's definitely hard, yeah.
Yeah, this is two of the companies that have what's called cohesive. This is a 4th-generation implant,
okay.
Silicone implant. They're very safe because the cohesivity of the implant gel keeps the gel inside. If it breaks, it stays inside. Or you can go to a 5th generation, which is this one for another company, that is what's called a gummy bear implant, which if I cut that implant,
right.
It's like a gummy bear inside.
And these have a more natural feel to them. And you were explaining to me off camera that this is a 5th generation, which is the newest on the
yes.
market, correct?
Yes.
So these, like you said, are least likely to...
All of these are very safe these days,
yes.
But when you increase the cohesivity, it holds the shape. When you put it inside, will not deform so much, will keep the shape, but also it's very safe. If it breaks, the head will go nowhere but stay in there.
Now, we actually have some before and after graphics of patients that have had breast restoration, and we can go over these and tell us about the procedures that were used. I know that you had mentioned before something called prepectoral and retropectoral. Talk to us about this. This is a patient who came in. This
is a patient that have a small breast. She went to have a mastectomy, and then we see here the expander placed behind the muscle.
Okay.
This is behind the muscle,
wow.
And then I think the next image will show her with her implant, and that's a silicone implant after reconstruction.
After reconstruction?
Yes.
So the second picture was just with an expander?
Yes. So you see the first picture, she was very small.
Yes.
Then we went to expander, we expanded space, and then we went back and put the implant.
That's incredible.
And if you can see, this image is much better than the first image that she had.
Right.
So we have great result with this reconstruction.
And now is there a specific restoration that we did with that? Now we have another patient here as well.
That's a one that is prepectoral, so you can compare this with the other patient. This patient went from having this to an expander, and then from an expander to an implant. And I think the picture that we have next is an implant placed. This is a prepectoral. So you can see this patient and the other patient, they have two different techniques with great results.